Good afternoon and welcome to UMACO TV. My name is Kemal Erkan. I'm here with Sean Donovan from our business development team. Sean, how are you doing?
I'm doing great. Kemal, how are you?
Good. So we are going to take a detour today. We actually felt like there will be a really good benefit of explaining our United Medical Clinic, our primary care, mainly primary care and pediatric office, and share the program, the practice structure, and make sure that our patients are able to understand exactly what to expect, and also get to know the practices if they are new to the practice. So we have we prepare a couple videos, so we are gonna follow those. Hopefully everything should go okay there. And one thing that I have to do is sign in the Zoom because I don't want that to check us out. Okay, so we want to actually start with the introduction of the practice. And let me make sure that our videos are in the right order. Sean, did you want to start from the intro?
Yeah. So as Kemal mentioned, today we're actually going to cover UMC clinic. Dive a little bit into more detail than we normally do on, general overview, but also specifics that patients who are either new to the practice or who may actually be existing patients and just not know of some of the resources we have. We want to dive into those and make them a little bit more well-known, how to access them, more available. That way everyone is aware of, the ins and outs of being a patient and kind of what to expect, and also what is expected of you from your end as the patient. So just to start off, we do have our general overview. You'll see on the slides that are cycling below, are mentioning our services, what we have. Obviously, preventative care, being PCP practice, we do offer lots of features and also pediatrics as well. So
we added some of those specialties because they used to be our clients before, and they actually became part of the United Medical Clinic. United Medical Clinic started as a primary care office. Then later on, we had the pediatrics join us. And so from the location standpoint, going from north to south, so we have an office in downtown Wilmington. That office actually is expanding. By end of this year, there will be 10 extra exam rooms. So, which is going to put us in a really good position to see more patients in person in the downtown location. Now, downtown Wilmington is extremely important, especially for primary care and pediatric standpoint. But also, this is our annex of our business office, where we would be able to have certain meetings, and also, it's an excellent place for our nutritionists, like from central office standpoint. So we are going to be able to service more patients in that location. So that's our goal. Now, just so that our patients or prospect patients understand, so in 2022, total of 46,000 appointments we were able to provide, and this is like almost 16,400 patients. So there is a big volume, and we want to make sure that in today's condition, providing service without compromising from the quality is extremely difficult. And United Medical Clinic is trying to do that while we are at the same time competing with nonprofit organizations such as Christiana Hospital, Bay Health, St. Francis, and other hospitals in the nation, in the state of Delaware.
Mhm.
So we mentioned the number of specialties we had, and how the service line is expanding, and being able to do more for the community. That's our main goal. So, Jean, if you kind of go through our physicians and providers who we have.
Sure. And just a question that even I just thought of, which maybe a prospective patient may have same inquiry, but just from a standpoint, if someone was trying to maybe see one of our specialists without already being seen one of our PCPs, are they able to, sign up and join maybe just to start seeing our bariatrician or the pulmonary? They can do that without having.
We don't have to be their primary care
Right.
for those specialists that we have under United Medical Clinic.
Mhm.
So that's a good question, because we are not a single specialty. So we are a multi-specialty in
Mhm.
terms of the practice structure standpoint. So if someone just wants to see our bariatrician, which in the case of our bariatric program from American Surgery Center, there are patients who would only come for Dr. Vanising and then get their bariatric clearance for the bariatrician.
Mhm.
So, and then they would go back to their primary care. And this is also true for our pulmonary, now Dr. Fariki, who's part of the group. So there may be someone who already has PCP, and then they would come and get their pulmonary services from our practice.
Mhm.
But I would say 90% or maybe 92% of the total is primary care and pediatric altogether.
Okay, yeah, just want to make sure everyone was clear on that, just in case that was maybe a hindrance or hesitation. But yeah, I can definitely go through and just, again, as you mentioned, you started with our Wilmington location. That is our newest office. We also do have the one here across from our central business office is our Bexwood location. And then down south, we have our Smyrna office. So most of our providers tend to work at the same location for the bulk of where they see patients, but it isn't uncommon to have some of them hop from location to location. And obviously, as you know, we do have telemedicine appointments. So if you're not seeing the provider in person at the office.
Sure. And telemedicine is the key, especially now for this flu season. So as you may remember, prior to COVID, telemedicine was not utilized properly.
Mhm.
And COVID actually pushed everyone to take advantage of the telemedicine. And now we have a really good structure to provide a really good quality service through telemedicine. So if someone already may have flu or some other, or they may be worried about getting the flu. So if you are in one of our waiting rooms, the chances are you're going to be sharing that waiting room with someone who may already have the flu. So, and if you don't want to be in that setting, telemedicine is a good way to get out of those types of situations. So, but in times we would like to see the patients in person,
Mhm.
and that's determined by the providers and the physicians. So that should not be a problem. I think one of the main issues also we have is the way that we structure United Medical Clinic in the United Medical ACO, and therefore the way that we have our patient wellness programs. In some cases, patients may be confused when they are getting calls for from different places, sure. But actually those calls are coming from one place, that is United Medical Central Office. So because we are able to take advantage of the economy of scale that we have, so then we are able to provide certain services in the central office, from the central office, which is our care coordination team, our nutritionists and dietitians, behavioral health specialists, our social workers, medical weight loss programs, the fall prevention with our PTs, and the way that we manage hospital admissions and readmission prevention. So those are all benefits of having a bigger practice and also being part of the ACO. Mm-hmm. So now we want to kind of explain from this point how this structure works
I think that's a good transition, actually, as you just mentioned that, because now our next video is actually on the care coordination. But just to wrap up with the care team for those patients who maybe need to want to learn more about their providers or are seeking a new PCP and want to get to know them, on our website, we do have our Meet Our Care team where you can actually go read their bio. Some of them do have videos talking about their experience, kind of what they do, what drew them to United Medical, what they like about our practice. So you feel free to check it out on the website, get to know them a little bit better. And some of the ones who don't have videos, we are in the works of getting those put together. So in the near future, you'll see those. But as you said, good transition to the care coordination process. And we're going to dive into a little bit of just how that's all interrelated and interconnected here.
So the care coordination is something that we designed specifically for United Medical ACO and all of our practices, not just United Medical Clinic, but all the other practices are part of this. So because, again, what we mentioned earlier, this is all about prevention and how we can actually provide better service. We have nurses and care coordinators who are helping the patients with those follow-ups that they may have with the specialist, or they may have hospitalization, and then right after that, primary care would like to see them, and then we would be calling and reaching out to them for those follow-ups as well. And in some cases, Sean, this is really important for hopefully for those who are our patients who are watching this. I think it's an important issue for everyone to understand. Today's clinical integration is not about just physician or the provider seeing you in the office. So there is a team, and this team is a multidisciplinary, from the multidisciplinary approach to the other extenders, ancillary staff, such as our nurses, our care coordinators, us, like you and I, we are in those teams. So when patient comes to our offices for a specific issue, our providers have only limited time to deal with that issue. Now, what we are able to do from the care coordination side is to look at that patient's chart at a broader perspective and then see issues that we may not be able to identify at the time of the visit. Mm-hmm. So, for example, you may be in our office only for, let's say, A1C management. A1C is the blood work that determines whether or not you have diabetes. So then, and in many cases, when that happens, there are other comorbidities comes with. And one of the most underdiagnosed issue that comes with these chronic illness is the obesity or morbid obesity. So providers may have to take care of that A1C issue and then take the A1C management approach. But in the case of obesity or the morbid obesity, that we may need to work with the central office and then ask to have a nutritionist appointment or the bariatrician appointment, or maybe suggest a bariatric surgery in some cases based on their BMI. Now, what we see in many cases, neither patients nor the providers have enough time in that specific visit. So this is why you would be getting a follow-up from the central office, and we would always discuss these with the providers. So we would not we wouldn't actually reach out to any of the patients unless we have the provider's approval. Now, as our nurses and care coordinators are working throughout the day, one thing that we were able to accomplish and establish is the case conference process. So what we do in the case conference, as you are also part of this, there are two teams. One team is led by me, and the other team is led by Donna Danko. Donna is our Director of Clinical Integration. So she and I, we have two teams. One of our business development resources, Sean, is in my team. Kim is in Donna's team. So then we have 4 nurses each, and we have 1 social workers each, and we have a pharmacist who rotates between the 2 teams. So every day, 1 hour, we are discussing the patients flagged by our nurses that should be discussed, and also see if we can actually help these patients in different ways. Yeah. Now, this is where you would be most common phone calls or the text message you may be getting is from our social workers, because we want to make sure understanding, providing the care is not just diagnosing and treating, but it's really understanding the entire picture of the patient, which means we want to know where you live, we want to know your financial strength, we want to know your family support strength. We want to understand our patient as a whole person rather than just, okay, so we are going to give you 2 prescriptions to manage your A1C, and then we'll see you in 6 months. That's not what we want to do. So then social worker would identify whether or not if you need more support. Now, this more support may come from us, or in some cases, it may be available through your insurance company. So this is why we are very grateful for the resources that we have. And I think our social workers are extremely important for us to be able to complete the care that we are providing for our patients.
Yeah, I would agree. And I think to kind of wrap that up into like a summation of the fact that we can't use that cookie cutter approach that every patient is the same. We have to actually, it's the social workers who are kind of on that front line, getting to know the patient, talking to them one-on-one over the phone, understanding their background, what may be a difficult scenario they're experiencing right now at the time, why they're missing that appointment, if they have a transportation issue. And knowing that and learning that from our patients is then what enables us to get them the type of care and quality care in the most effective manner possible. And sometimes, like you mentioned with the insurances, patients are unaware of some like the benefits that are actually available to them and the services as well. So give a lot of credit to the social workers. Yeah.
So now, in this process, one of the reasons that we felt like we should have this video, as I'm the CEO of this operation, every time there's a bad outcome on any of our patient surveys, I review those personally. So it's been screened through by my team, and they actually provide all the information that I need. And I also reach out to the patients when we feel like there is a reason that actually there was a breakdown on the service or communication, or something that can be improved. So because I started doing that, so then I also have a really good understanding of some of the issues that our offices and our patients are dealing with. So we want, hopefully, we want our existing and new patients to watch this episode of our YouTube show and get a better understanding of some of the things that we are asking. So one definite element of the patient ask is the patient portal.
Yeah, I would agree.
Now, in year 2023 and the year of COVID and the pandemic and all the other issues, communication and digital communication is the key for every other probably industry, but it's more important for healthcare. So, Sean, you are part of the business development, and you probably get a lot of patient portal related issues. So how simple is to use the patient portal and what we can do with the portals?
I mean, right when you sign up, you're going to get that invite from the office, and it's, again, with our ACO, whether it's UMC being a specific PCP or any of the specialists, but they're all going to be inviting you. If you do not already have an active portal, you'll get that invite, and it goes, all you need is your email address. That's all you're giving to them. And boom, the invite's sent right there. And literally takes less than a minute where you sign up. And the key with the portal is having that immediate communication line, but also think about, like for me, example, if I get like blood work done or any labs, any x-rays or whatever type of media or results that you're looking for, you're able to access that immediately, and you'll get the notification pop up in the portal, and you'll be able to communicate whether it's seeing your results, reviewing the results that you were waiting on. I know sometimes that adds stress to patients if they're waiting, I need to see when I get my tests back, but I can really go on that vacation, or if I have to end up getting this surgery or, XYZ. You're getting that immediate feedback. Also, your provider or physician will be commenting on that, telling you, we saw that your levels of, this cholesterol is high, but don't worry about, this, it's still in a stable range. But also with the portal, not only are you able to see the results, but like I said, having that communication line. So we're going to dive into this a little bit later, but say if you need to schedule, reschedule, cancel appointments, but also getting medication refills, any other type of inquiry that you have, that's your immediate contact line, as opposed to a traditional, maybe trying to call the office if we're on lunch, or being on a phone call queue. This patient portal communication line is the most effective and efficient way.
So, and I wasn't actually checking the message, but I was trying to open the portal. So now, even I'm the owner of the practice, I still utilize all of our resources, and all the portals are available. So then I can actually understand if there are any issues from the end user standpoint. So while Sean was explaining what the patient portal is, I went to my app and then opened my chart. So I'm able to see, I write on my phone, or if I'm at a computer. So it's just so simple to see certain things. Now I can, right now on the first page, my latest lab results. If anyone is interested in my iron level, it's 134. If you are interested in my iron saturation, it's 29%. So, but the reason I had this last study was my hemoglobin was low in November, and this study is, my latest one is from March 2023. Now my hemoglobin is 14.8, so there's no concern. So, and now I don't have to call anyone.
Oh, yeah.
So then now, while I'm here, I'm able to go to my appointments. One of the things that we are going to go through the do's and don'ts of the certain things, but what portal is able to give me is, one, I can see my upcoming appointment. So let's see if I have one right now. So I do have one. Screen is, so one upcoming appointment. I can see that, and it just tells me that on September 21st, okay, actually that's coming up next week, I have an adult physical exam, and then at 1 p.m. So options, I can add this to my calendar, I can view details, I can reschedule this appointment, or I can cancel this appointment. This is before we go to our appointment reminder. So
so like I mentioned, as you're even showing right here on your phone, how easy it is to have that access. Again, you don't have to then call in, you're not trying to get in touch, unsure if they got your message that you're trying to reschedule or playing the phone tag. You're having this immediate access on your phone right there. And so even if, say, you're out at lunch and, I just forgot I have an appointment tomorrow, like you can do it right there. You don't have to be at home on your computer. Obviously you have the mobile app right here, but in the do's and don'ts, we are going to cover a little bit about that rescheduling. But one other thing you did mention, though, was the appointment reminders. So we do have our text and call reminders that do go out 3 days before the actual appointment time. So it's during the normal business hours. So you're not going to be getting, phone calls at 1 in saying, come in.
It's done usually by 3 p.m., but it does call, I think, 3 attempts. So then
until, to get that voice recognition would let it know if you're confirming verbally.
And why this is important, again, is like we want to utilize this episode again, maybe have some direct communication with our patients. And for example, I have a haircut appointment on Saturday. Yesterday, I got a message saying that please confirm this appointment. So, and I did confirm, but every time I don't, then I get a phone call. And same thing with us. So if we look at the reason we run the appointment report 3 days before for confirmation, so then it gives us at least 2 business days to reach out to those patients who are not able to confirm their appointments. So one of the things that we ask our patients is to take these appointment reminders seriously. So then we have limited number of cancellations last minute and no shows. And also you can prep for the upcoming visit. But from the practice, there is so many different times, so many different number of attempts that we have to close that gap. So now I want to explain now, we went through the patient portal, we went through the appointment reminder, but there's one other communication. Again, this is a clinical clinically integrated group. So if we were just one PCP physician in one location and then all I see is 20 patients and it was 1967, beautiful. So you didn't have to worry about any of these. So you would make the payments by chicken or maybe like some tomatoes and some cheese or yogurt or milk, but it's not 1967 anymore. So then we have a system in place that requires so many things from the primary care office mainly. So because communication is the key, and because some patients, they may not use the EMR portal, we created another portal for us to be able to reach out to more patients. Mm-hmm. So I want to actually, and I don't know, Sean, if I told you this, why we had to do that. So even if someone has a portal, like from the EMR, in some cases for them to open that message, like they won't see what we send them unless they open the message. Okay. So to eliminate that, we created our database emails, which goes directly to the emails, and it's on the subject line. It will tell you exactly why we are reaching out to you. Sure. So all these efforts are is for us to be able to increase communication and close the communication gap.
Yes. So with the quick-based emails, again, this is also related to our case conference process. So the nurses, we're going through these patient audits, looking at their charts, seeing what type of specialist or referral they may actually need. Like, oh, this patient with the high blood pressure, hypertension, let's get them into the cardiologist. So these email templates, it's already filled out. It'll be specific to the patient, point in obviously their name, any other relevant information, if it's like a lab level specific to them. But as you mentioned, it's going right to that email address with the subject line. So they'll know, oh, diabetes management or high risk diabetes, where you really need to go in, see the endo. And not only are they clinical ones, like you're mentioning, we also have reminders, say it's like a high no-show, or I'm just thinking off the top of my head, we have.
Well, if they have multiple no-shows, if they have compliance issues with the medications,
adherence,
if they have issues with the specialist follow-ups, so we have those types of emails. But mainly, again, our goal is, so we take this very seriously, and while we are doing that, we also understand that this is not one-sided. So there are two parties to this. So we want to do our part best, and we want our patients to also understand what's needed from their side, and then they can have a pleasant experience from the practice services standpoint. Now, one of the other things with the portal, if anyone is having any issues on the United Medical website or United Medical Clinic website, you will be able to see how to videos. There's a section, and then that will actually explain certain things, how to sign up, and all that thing will be covered in that in those videos, so you will be able to see them. Now, I think we're okay to go to do's and don'ts now, right? Did you cover everything?
Yeah, I mean, as you said, with those quick-based emails, again, I just pulled up the slide that they may have been seen in the slide deck down there, but also it'll be like friendly reminders on, oh, your blood work, you had a blood work order, we really need to get that in. That way we can proceed with, seeing if we need to get you a referral to their specialist. But yeah, I think that's pretty spot on the quick-based emails. And then now, yes, as you mentioned, the do's and don'ts of kind of just like the best practices. That's the term we use here on what's the most effective approach to being a successful patient.
Now, do's and don'ts is kind of tricky. So because we are here to provide a service, and we appreciate all of our patients who choose us for their primary care and pediatric and other services. However, especially I actually look at all the surveys with the negative results. I can identify certain issues. These certain issues, whether or not can we improve what we do from our side versus is there a gap on the patient's understanding? And then both are given. So both can happen. In some cases, anyone who is who's not maybe aware of this, but they should be. There is definitely a shortage of good quality employee resources. So COVID actually changed all the equation. So, and this is not limited with the medical practices. This is also true for any other industry, and all the friends that I talk to and all the other people that I deal with, they have the same issue. The issue is, well, there's always the shortage of employees. Now, this is not patients' fault, but this was also true 10 years ago. So when you were to call one of the medical offices, if you call them on their main line, easily you would be on hold for 20, 25 minutes. That's not the best, but it's kind of like, you know, it is what it is. So now we know why that's happening. And I'm going to say that I'm going to tell you why it's happening, because when you call American Airlines, you don't get a live person when you call them. What you get is the automated system tells you, well, tell us, well, just leave your number, or just we'll record your call and we'll be calling you at this time or that time. So you would be the 5th on the queue or 10th on the queue. But that's pretty much everyone accepted that without any problems. But when it comes to, unfortunately, when it comes to healthcare, we don't have the same appreciation or same maybe same kind of like understanding of why like certain things cannot happen or should happen. Mm-hmm. Your video is fine, actually. So it's a little bit blurred, but I think it's
okay. Certain and more of blurred.
So here's what's happening. Here's what we expect. Phone calls, I would love to answer all phone calls right on the time that they call us. But we gave some numbers earlier. So when you have 16,000 patients to serve in one calendar year, it's humanly impossible, almost inhumane, for us to be able to answer calls as they are coming in, because there's so many calls coming in. And then you can only have so many people. Even if we hire, 200 people, there will be times where they won't be able to answer all of the calls. So the solution is two ways. And this is why we put these do's and don'ts. And many of these things are the things that I cover when I call the patients on our survey follow-up. Yeah. Because I see a chronic problem where someone is just calling. Look, so my hair salon or the barber says, you have an appointment on 9/16, 1 p.m. If they were to call me, I was never going to pick up that, right? So they text me, and then I say, all I need to say is not even like spell out the yes. All I need to say is like the letter Y. Mm-hmm. And that takes care of, so now they expect me on that day. So that means they communicate, and then they complete their part, right? So we expect the same thing. So this expectation is, when you are getting an appointment, if it's not urgent, calling is not your best option. So we have people in the call center, but we have also people who are answering the incoming inquiries from the patient portal and from the database portal, and two different places that we are still able to call people as we are getting the messages. So that's the best way to do it. So instead of like someone, and this is not even like any of these things, anyone wants to challenge it, please come and sit down with me, and then I will show you exactly what we have. So someone complains about being on hold for 25 minutes. The reason for the call, canceling my appointments. Well, don't bother. So just go to your portal, or if you don't use the patient portal, go to one of our quick base patient inquiries and put a request for cancellation. We'll take care of it. Yeah. But if you insist on talking to someone, that's not acceptable. And it's not reasonable. So because the reason I'm giving you my barber example is because I don't do that when I deal with other practices as a person. So then why would we expect that that type of service? Why would you have to talk to someone to cancel your, rescheduling your appointment? You can always utilize the portal. Now, one of the most common issue with the don'ts, do's and don'ts, we can start maybe from the prescription, medication refills.
Mm-hmm.
So, and you and I, we see so many of these in our case conferences.
Yes, very. Mm-hmm. So, with the prescriptions, I think, as you mentioned, it's very common in the case conference. We see a lot of times where patients will be getting that flag because we think, they stopped taking the medication because they haven't gotten it refilled, and they should be on it. The physician's under the assumption, you're still taking this. So I didn't tell you to stop taking it, so you should be getting that refill in a timely manner. But yeah, just going at the do's and don'ts. Again, first thing on the list is use the patient portal. It's going to be the most effective way. You're not calling in and waiting on that queue to say, hey, I'm running out of medication. And when you are in fact running out, at least a week prior, because as you know, it'll take time sometimes for the pharmacy to receive it, to fill the order, for you to be able to go pick it up. Maybe, you can't get there that same day, transportation, you have your own personal life. You don't want to wait until the very last second to say, hey, I'm on my last pill. Hopefully I can get my medication refilled by tomorrow morning.
Yesterday.
Yeah, exactly. Yeah, or exactly. So that's unrealistic. So having that buffer time, if there's a little bit of overlap, that's fine. You want to get it down. And then also just moving down the list there, letting the PCP know if, these medications are having side effects. I wouldn't recommend, I'm sure I'm not a physician, but you can talk to them. You don't just stop the medication on your own without letting them know. They're under the assumption that you have been taking this type of medication is in your system. And the way that it's prescribed is if it says to take twice a day with food, you should be taking it twice a day with food. Not, I'll just skip this one because some of the medications, they want to have a certain amount in your system at all times. And then also one other thing point down on the list here is if you notice you're running low and you're trying to maybe stretch it out. Sometimes we see patients who will say, I've been half dosing, I'm supposed to be taking 2 pills a day. I'm just taking 1 a day because I think it might run out. Obviously not the ideal approach there. So
the other thing is that when you don't have any more refills, that means your physician, your provider wants to see you after you complete that cycle. So you have the medication given, and then with 1 refill. After that 1 refill, if you call us for a refill, we won't prescribe that because that's the standard for us to see you. That means we may have already 6 months last time we have seen you, or maybe even more. So then we are not going to just refill the medication that has 0 refill.
Yeah.
So this is kind of like, let's actually just elaborate this. So then I will make sure that this is clear, and maybe even Sean, for you, I know that you see this every day, but I want to make sure that everyone understands. So when physician or NP or the PA says, here's your metformin for initial 90 days, and then there is 1 refill. After that 6 months, don't call us for refill because that means you need to be seen.
Been used. Yeah.
That means you need to be seen. So that's one of those, very chronic issue that I see all the time. Same thing happens with some of those medications who may be under the narcotics. Mm-hmm. Well, you have to be seen every 3 months for some of these. And then we can even send the prescription more than 1 month at a time. But at a minimum, we have to see you in 3 months. For example, if you are on Adderall, you should expect to get a random urine analysis. And you can insist. The problem is you cannot insist getting these things because we won't do it. So for you to argue with our call center and whoever is talking to you is not going to get you anywhere. So that's why I need everyone to have a good understanding of what the expectation is. The expectation is we have to follow the medical standards in order for us to do our job. So I just want to give you an example so then you guys would appreciate some of these, and also I want to put this in perspective so there's no question. So there was a again survey follow-up, and this was the husband who was the patient, but when I called them, he put me on a speaker phone, and the wife was talking, and she was talking over him. And the issue was, we haven't seen them for 12 months, and they want refill. And she was arguing with me, and then she's like, "Oh, my, daughter is a nurse," and blah. Like, I'm like, it has nothing to do with what we do. I haven't seen your husband for 12 months, and he has to come in.
Yeah.
So, are you able to prescribe medication for him? No. Can your daughter? No, she's a nurse. So then you have to follow our orders. So now, of course, when I have that discussion, it's a different level. But when the call center has to get these confrontations, it's extremely stressful because they are limited with what they can and they cannot do. So putting too much pressure on them isn't just going to make everyone else's life is more difficult. And we actually ended up discharging quite a bit number of patients just because they didn't have the understanding of what the expectation is. So there are, I always say that healthcare is the heavily regulated industry. So liability is huge. So for someone to expect us to just give medication without being seen for the entire year, ain't gonna happen. So it's not the right practice. There are some practices out there. They may actually take those types of patients, but we won't do that. So our goal is to do our job at the best level and then make sure that when we go home, we don't have to worry about putting people in trouble. So now, on the scheduling, we also have do's and don'ts. I kind of covered maybe a little bit of it in the structure of the clinical integration, but if you want to cover that as well.
So as we mentioned, a lot of it is with the reminders. So confirming those, like you said, the call or text reminder. Again, on those, when you're signing up, you can put your preference on what you want. But just in general terms, obviously showing up ahead of time for new patients, there is that patient packet that actually you'd be filling out on your own at your own leisure, the week prior or so when you have the upcoming appointment. That way you're not going to show up day one and then have to sit, balancing a packet in between your knees, filling out paperwork in the office for 45 minutes. So you're able to get that packet, download it online, print it out, fill it out at home. That way when you're showing up, obviously you have your packet, your ID with your insurance card, making sure your PCP is up to date on that insurance card. The right insurance is your primary. Your switch insurance is obviously letting the office know. That way they can update on the chart. That way I know that saves the headache, both on our side with the billing, but also on the patients are going to be getting bills in the mail and saying, oh, this should be paid, XYZ. Having that up-to-date documentation is obviously important. And then just the do nots there is obviously don't arrive late expecting, because as you know, there's multiple patients seen in a day, throughout the hour, multiple physicians in the office, very busy. If we wait around for you who's running 45 minutes late, you can't expect to be seen right then. Like, oh, I had an appointment, I should go to get in. Understanding that that mutual respect there with the people's time.
And I can tell you, like in medical offices, the wait time is given. So I don't want to promise anyone that they won't wait. So getting your coffee at Starbucks takes 12 to 15 minutes. So, and you have to wait. So medical professions, it's limited out there, and we want to be on time for every time we see patients, but that's sometimes it's not possible because there are patients we scheduled for 15 minutes or 30 minutes. Someone takes maybe 7 minutes, but someone may take 25 minutes, and then we still need to kind of see all those people. And waiting. And I'm not saying that that's the standard, but that's everywhere, and it's unfortunate that it's going to happen. It's just maybe easier to accept that. So I'm not going to be unrealistic and trying to overpromise anyone that they won't wait. You will be waiting. So we wait for everything. So that why are we not waiting for the physician?
A key to the care you're getting, because you wouldn't want every appointment to be you're in and out in that 15 or 30-minute time slot, because then what quality care are you actually getting? Like, you want the physician to be able to talk to you, discuss what your concerns are, discuss the alternative options that you have to that care. So it's obvious that some of these appointments will run beyond, but that's to be expected because obviously every patient again is unique. So it's not going to be a cookie cutter. Everybody's in the slot in and out like a factory line.
Yep.
There's give and take.
So now the other do's and don'ts, the topic level we want to cover is pain management. We are gonna actually, put this video out there after the live, and then we want patients to hear directly from me. My practice will not do any pain management, chronic pain management with the prescription. So we will not manage oxycodone. We will not manage Percocet. That's not what our specialty is. Because of some of these things I see where patients are going to the urgent care, unfortunately, they do, we have some benefits from the urgent care. They can be utilized in a good way, but in many cases they don't do the right thing and then give the patient for 5 days of oxycodone. Same thing is done by the hospitals, and then they expect us to do the same thing. Just because other people are jumping from the bridge doesn't mean that United Medical Clinic is going to follow that. We follow the medical standards, so that's our base. We will not do chronic pain management. We in United Medical Clinic in United Medical ACO have a pain management specialty, and we expect them to manage these patients. So not only we won't do the pain management, but we will definitely not do the refill of the pain management over the phone. So these should be, I can tell you, all these things that I'm talking about right now covers almost 90% of the patient complaints, because that's what the expectation is.
Yeah.
So now the other thing, if you want to cover the consults and the referrals part of it with the do's and don'ts.
Yeah. So again, just showing you a general overview. Again, this isn't super specific, not every item covered, but consults and referrals. So this is obviously if you're seeing specialists outside the PCP. So just some of the do's that we see there is first off, scheduling the appointment before self-referring to a specialist. So come in and see your PCP. Don't just on your own say, hey, I'm feeling the chest. I need to go see this cardiologist. Like I'm just going to call. Like,
and then not just calling us and then they're requesting a referral. They're like, we haven't seen or saw this patient.
Exactly. So obviously, come in, have the PCP check you out first. Let them get a better understanding of what's going on, and if a consult is needed, obviously they would go ahead and do that. But perhaps it's something else that's causing you that discomfort or something. They'll be able to better gauge what's actually happening. Again, commit to recommended testing by your PCP in a timely manner. Best practice to go in network. So again, we have communications with our specialists, with our PCP offices. So we want to be using the ones that are on the same page, have that same cloud EMR chart access, so everyone knows what's going on. It actually just makes it a lot more easier when everyone's already aware of other pre-existing conditions, medical history. Checking in with your insurance if the referral is required. Again, I think that's just recommended that you want to see the PCP get that referral beforehand regardless. And then just, this is similar to before, making sure that the right PCP is listed in your insurance to prevent that delay getting that referral. And then the do nots on the right side, don't forget to see your PCP prior to seeing the specialist. Also, I think it's recommended maybe afterwards seeing the specialist, if something alarming does come up, that you want your PCP to then be aware of, this was found at my specialist, they did this, echo and found this, as the best result. And then don't refuse to recommend routine or diagnostic or prevent delay in diagnosis. So if they're saying you need to go get your test done, this type of lab work, whatever, it's needed for a reason. So
what our goal was in this last 50 minutes, again, for United Medical Clinic patients, what to expect from us and what's the common issues that we see and how we can actually serve you better. So that is, again, there are certain things that definitely the patient side needs to actually do so that we can actually improve some of these services. But I want to point out one other thing that we didn't mention earlier. One of the survey issues, or one of the maybe portal requests that we get related to your last consult, and also like the refills with the authorization, prior authorization. So a lot of patients, they assume that authorization is not started from our side. It's not initiated. because they have to wait for a couple of weeks in some cases. So I really need our patients to understand that there are two other big elements of those issues. One is the insurance. The other one is the pharmacy. There are some pharmacists in the state of Delaware, and then I had to deal with one of them in August for my medications. Mm-hmm. So because of my support at home, so I had to change my prescription, the pharmacy from Greenville to Bear. The Bear guy is pretty out there. He thought I was not using the prescription properly, although I can see all the history of when I refill them. And he didn't refill it. Mm. He didn't refill my own medication, and I own the practice. So this is not, there is no exaggeration. He did not fill. So I have to go back to my other pharmacy because they know who I am, I guess, because I've been in their system for so many years. Sure. Although these guys can see that, but somehow that day there was a on-call pharmacist who was covering, and he just didn't want to do his job. So make sure that you understand that this can happen. So the other part, the second one that I mentioned, insurances do not process these things in a timely manner. Just like we have issues with resources, they have, although they have more money, a lot more money than we do. So, but they still have resource issues. So sometimes these requests, they don't process it in a timely manner. So it takes up to 2 weeks. Now, with this, I want to make sure that, especially these weight loss medications, 2 weeks. It takes 2 weeks to get the authorization. Don't even get upset about our office not doing something. It's just we are just waiting on the insurance company. Now, everything that we have is trackable, so we can provide the electronic ID numbers for these transactions. So let's have a really good understanding and good expectation of what needs to happen, so that we can have a pleasant relationship, and we can improve what we are doing. In some cases, we are just we are just doing troubleshooting for patients who really don't want to follow through the instructions, and then that takes time away from other patients. So we are hoping that this session we were able to provide hopefully some important elements of the expectation and the structure, so then patients find these resources on their own, and then utilize the right elements, right vehicles to reach out to us. Speaking of that, do you want to mention the YouTube?
Yeah. So as you're saying, the resources that we have available. So obviously this 2 p.m. session is every Friday. Whether we have a clinical focus session with one of our PCPs or an outside specialist joining. We also cover the billing side, so it better help us better understand the billing process and kind of what may cause some of those delays and how it all relates. And then also our political ones that we have with any public figure who is maybe working on legislation that will impact the healthcare. So those are our 2 p.m. sessions. 3 p.m. we also have the Bariatric Friday, so that's the entire weight loss journey. And that's a cyclical series with Dr. Yergau, where we cover from day one, whether, contemplating getting bariatric surgery versus, the process of healing afterwards. And then also we have our wellness webinars that we have on our 2 p.m. That's going to be the second Friday of the month in place of our 2 p.m. session we're on right now. So Donna, our dietitian, Caroline, will join. We do cover various topics related to diabetes there. And then also our support group we have, so like a weight loss bariatric support group, a Facebook support group we have. And then on our webpage, you'll see various different resources, whether it's behavioral health, wellness, seminars, the dietitian, any type of those resources that you need, all available on our website. So there's plenty of information out there and a lot of educational material that can be used by our patients and everyone in the community.
So everything is now available out there on the channel. We're overreaching to almost 2.6 million views. So I know that people are watching. 2.5. So we want to make sure that these are reaching to the right people. So hopefully we can do better in many aspects of what we do for our patients. Well, thank you for watching us, and we'll be back with our Bariatric Friday event with Dr. Erkan in 2 minutes, hopefully. And then we'll be back next week with our other topics and other sessions. Thank you again, and we'll see you soon.